to get a quote to get an idea of how much a surgery would cost? I do. I have United Healthcare Choice Plus. Okay, thank you so much. Basically, they need to have the surgery needs to be booked already, or I need to have a doctor so that way they can call the doctor and know how much time I'll be spending in the operating room. Would I be able to get the estimate cost of a surgical procedure? They're going to email the biller and have them call me. Said, sorry, that extension doesn't answer. Okay, so now I'm going to call the Surgery Center of Oklahoma. Hi, I wanted to know if I would be able to get a cost estimate for a tonsillectomy. I'm sorry, would you be able to repeat that? I didn't hear you clearly.
$3,050.
Okay, and what does that cover?
Facility, surgeon, and anesthesiologist.
Okay, and that would be the total price?
That is correct.
All right, thank you so much.
Anyone that accuses the United States healthcare system of being broken, I would agree with. My name is Keith Smith. I'm the managing partner at the Surgery Center of Oklahoma.
My name is Dr. Stephen Lontier. I'm an anesthesiologist, and I'm the co-managing partner of the Surgery Center of Oklahoma. If I was going to say in a word what happened to us, I would say frustration. We both started despising what was going on financially with the patients, because when you look at the bankruptcy statistics, medical bankruptcies for patients now, it's egregious. I mean, the average American cannot afford health care today.
So in 1990, I started my practice in anesthesia, working in the big hospitals, and worked there for 7 years, during which time began to see the medical and the financial dysfunction, all of which affected patients' pocketbooks and the care they received. Having seen enough, we decided to open the Surgery Center of Oklahoma, knowing that controlling the institution and the care delivered there and the charges inflicted on patients needed to be under our control. When we decided to walk away from all insurance, our backs really were against the wall.
It was either we were going to close or we could do something completely different. The reason that we can put it online, one thing that many people don't know, is because we don't take federal money. If we took any federal money, Medicare, Medicaid, we could not do that.
The growth was extremely slow, but when the word started to spread, we were introduced to members of the self-funded community, and when they realized that they could buy surgeries at our facility for 1/10 of what they had been paying, then they started to line up, and the growth became much more aggressive. A little bit easier.
Sure.
So he's going to put this needle in up here, and you'll be able to see it on the ultrasound machine here.
Can you operate the ball?
I am Gretchen Tate, and I'm here to have a carpal tunnel release surgery. When I started looking at this surgery, then I came to the website and did my research. My husband had a surgery last Friday here. We did the same process with that.
Okay.
Oh, I was thrilled because I originally had this surgery scheduled to be done with an orthopedic surgeon in Tyler, Texas. But since that time, the surgery center that they were using had sold to another bigger company, and the price of the surgery quadrupled.
And if you take the typical exchange, between a patient that goes to a hospital that is covered by insurance, there are so many people that are taking their cut off of that exchange. And in essence, ours takes all of that away, or I should say 90% of it, and it is very disruptive. The insurance companies would like for us to be out of this business. The hospitals would like for us to be out of this business. The real question is, why are the hospitals 6 to 10 times more than we are? And that's the question that it took Dr. Smith and I a very long time to figure out, but we understand it now.